Puerto Rico and elsewhere. Senator Murphy.
Thank you. First of all, good morning, everybody. Thank you all for being here. When Hurricane Harvey hit Texas, we know how devastating that was, and our office had gotten a bunch of phone calls and figured out how we could help. Well, I'll let you know, in 96 hours, we had an 18-wheeler that was donated, and we had a gentleman that was willing to drive it down to Texas, donation of gas, and 50,000 pounds of supplies were put together in 96 hours and driven down to the poor people in Texas. Well, then here comes Hurricane Maria that devastated Puerto Rico. Again, our office was inundated with phone calls. How can we help? We have family members that are living here in the United States, and you have one gentleman that's sitting right there. Jay, your phone calls back and forth was very instrumental in getting us going. The reality is that these people that are living here in the United States, and specifically in New York, have family members that were extremely worried about them in Puerto Rico. But it's Puerto Rico. How do you get there? You can't get in your car and you can't drive. So there was a lot of stuff that started happening of this year's budget. I'm going to revert back a little bit. In this year's budget, we were able to secure a $500,000 grant through the Center of Excellence. And the Center of Excellence is a New York State designated program that focuses on specific subject matter. There are 11 centers of excellence across New York State focusing on a wide range of issues. This particular Center of Excellence, right here in the Hudson Valley, was designated by New York State this spring and opened its doors in this July. It focuses on the cutting edge of disaster medicine led by Dr. Reilly and Dr. Amler right here in our backyard. So when this hit, the office was getting a bunch of phone calls. My first phone call was to this gentleman on my right, Dr. Amler. Is this a possibility of us trying to actually do what this Center of Disaster Medicine is set up with? He goes, Senator Murphy, hold on. I'm going to make a phone call and I'll get right back to you. Now, correct me if I'm wrong. I believe you were in Denver.
Yes.
He calls him up in the middle of the night in Denver saying, Dr. Reilly, we're going to do something. And within, I want to say, a 5 or 6 hour period, we had to go. But the problem is getting there. How do you get there? Well, again, that was a lot of divine intervention happening. I just want a massive, massive shout out to this gentleman on my right, Eric Faulkner and Ross Aviation, because this would not have happened if we did not have him on board. Thank you very much. So, there's a lot of moving parts that came together really, really quick. We got the green light. We got the green light. Okay, our mission. What's our mission going to be? Dr. A, I leave it to the experts right here. Well, you have metal, trees. It's a first-class disaster. Let's get down and try and get in there and vaccinate these poor people. So the next phone call was to this gentleman right here on the right, Lee Perlman, Greater New York Hospital Association. Lee, you gave us the goods to go and do what we needed to do and take care of some of these people as much as we could within a 72-hour period. I can't thank you enough. The team was incredibly grateful to you.
Our pleasure.
Thank you. So we assessed the team, we got a ride, we got medicine. All within a 96-hour period, on the tarmac, and off we go. We landed, I believe I kind of lost my Friday afternoon. Friday afternoon, was greeted by the Lieutenant Governor down there, and he could open us with open arms with the San Juan Police. We directly went, we carried everything that this team needed, including all the supplies that you brought here, Doc, on our plane. So we were ready to go. It's not like we're gonna wait, ship stuff down, and wait for it to arrive, and then pick it up and go. We had everything on the plane, put on our in our cars, and off to the command center. And you can see some of the pictures of us that in the command center of figuring out where to go. Well, we didn't waste any time. It was getting dark because there's no electricity. There's absolutely no electricity in these shelters and churches. There's no running water, and there's no communication. Well, in order to get there, thank God we had police escorts, because we wouldn't have been there until it was nightfall. We got in there, immediately went to a shelter, saw those poor people. They came out of there. They came out from I don't even know where. They just started lining up, and water, the ready to eat meals were brought out by our Port Authority police and the San Juan police, and it was just a really, really big team effort. I'll let Dr. A and Dr. Mike to elaborate a little bit more, but I want to say I have to acknowledge that I will call the Strike Force 40 team. This gentleman right here who put it all together, Dr. Robert Amler. I would like to also acknowledge the Director of the Center of Disaster Medicine, Dr. Mike Reilly. Ed, you can see the pictures of Ed, volunteered his time, and where's his beautiful wife that was here today that allowed him to come down with us? Thank you. Your husband's awesome. It was great. Thank you. We also had a gentleman, Jose, who was a trauma nurse for 18 years, I think, correct. Something like that. Correct me if I'm wrong.
No, that's correct. Yes.
A wonderful, all Spanish-speaking, fluent, which was crucial, because I don't speak a word of Spanish, unfortunately. But we pulled through. We also had Megan Florio, who was a nurse who came down with us. We had Martha Ruiz, who actually, my chief of staff ended up making contact with her, who was our translator. We had a gentleman, Hugh Fox, right here, who helped us with security. And then we also had Peter Michaelis, who, these lovely photos that you see around us of the devastation, and to bring this home and let people know what's really going on in Puerto Rico. Peter, your pictures are outstanding, and thanks for coming down with us. It doesn't happen without, again, getting it all together. Ross Aviation, Eric getting us down there, Lee, you gave us the goods to go. You gave us the goods to go. We can't thank you enough.
You know, Senator, one thing that I think is very important to note, and I want to give great kudos to Strike Force 40 and you senators, that we have seen in this emergency, British Hospital Association has been right in the middle. The response from New York State has been disproportionate. The response from our hospitals has been disproportionate. We've done 15 supply missions. Yours was actually the 16th to bring supplies to Puerto Rico. And it seems very helpless there. It does seem very helpless there. I was there 2 weeks ago. But the reality is that every piece of work that somebody does changes the barometer. And you folks going down, and it seems like, what's 1,000 vaccines? Well, 1,000 vaccines, you can't put a price on vaccinating one child or 2 children. And I think what is lost in this, and I think these pictures and you're going down in your stories give context for how Puerto Rico is going to be helped. It's helped one piece at a time by real physicians going down and your leadership, Senator, and actually making this happen. There are a lot of people around the country talking about going. The number of people who have actually gone is not really that much. We have, I think, 78 hospital employees who are there now under a mission organized by Governor Cuomo. But there aren't dozens and dozens of people who've gone down from the United States, from the mainland, to go help. And the fact that Strike Force 40 was able to get its act together, and again, it's because you have the generosity of a private plane. All the missions we've done have been based on the generosity of private planes, because the mainstream way of getting there does not get the supplies into the hands of people who need it. When you see the pictures of the boats and the cargo, by the docks, that's not getting anything to anybody. And the most important thing about supply missions, the ones that you did and the ones we've been working on, it's about getting drugs and other supplies into the hands of people who need them and doing direct administration. And what's so elegant about what you folks led is that you were dealing directly with patients within hours of being there. So kudos to everybody. It's our honor at Greater New York Hospital Association to have purchased supplies, been able to get 1,000 doses of high-test vaccine. This stuff is in very short supply. We, Greater New York, have bought thousands and thousands of these doses and brought them down to Puerto Rico in addition to insulin and other products. So kudos to all of you, but most importantly for making it happen, and most importantly for actually doing something.
I'm just going to give a few more thank yous, and then I'm going to turn it over to Dr. Amler and Dr. Reilly. The San Juan Police, if you look at some of the pictures, we would have never ever gotten into these areas if it was not for the motorcade that the San Juan Police gave us, and I'll call him Chief George, even though I know he's not the chief, but that's just the way I call him, and our Port Authority over here. It was a team effort. This wasn't a turf war that sometimes can happen. Our Port Authority police officers and the San Juan Police mixed together like a marriage. It was unbelievable to see everybody come together and work together as a team for one mission. It was impressive. Today here we have the Port Authority Chief Lewis. Clark Lewis, thank you for allowing your members to come and protect us and engage with us and be part of our Strike Force 40 team.
Sir, it's our honor from all of the personnel here and the personnel still serving down in Puerto Rico. We thank you for acknowledging our work. It doesn't come unnoticed, and we were talking ahead of time, and something like this does not happen that often for us, and we thank you from the bottom of our heart. Thank you very much.
Well deserved. Also, a quick shout out to the Westchester County Department of Emergency Services, who loaned us 2 of their satellite phones, which were crucial because there was, as you can see, there's zero communication going on down there. To the Puerto Rican governor and the lieutenant governor, they treated us with open arms. Whatever we needed, they gave us. To the Puerto Rican Department of Health, they were just wonderful, always by our side. And to Jay, thank you for the communication back and forth of making sure we had Carlos on the ground to talk to Eduardo, for Eduardo to talk to Luis, Luis to talk to the governor. So the line of command, how it all gets put together, there was some divine intervention that happened in order for us to pull this off in 96 hours, and it happened, and I just want to say thank you to you all. With that being said, I'll turn it over to Dr. Robert Amler.
Again, as I said earlier, Senator Murphy has been our champion in community preparedness and response to disastrous events, however they occur, whether they are natural, whether they are man-made, some accidental man-made and some intentional man-made, but the same cascade of events following a disaster in a community occurs, and that is we have to get together and respond. Sometimes there is an enemy involved. In this case, the enemy was simply the reality of what happened, and you couldn't get that back. You couldn't fight that. All you could do was consequence management, and so that is our mode. It's been my experience over decades in managing these kinds of crises that your very first casualty is information. Nobody knows where anybody else is. Nobody knows exactly what's happened. You even hear on TV shows or movies, they'll say, damage assessment. You know, what's happened, how extensive it is. And between these photos, some of you may have seen the lead article this morning in the Wall Street Journal, because it was actually 1 month ago today that it happened. It was September 20th, and today's the 20th again. That you really feel the full extent of the devastation that has occurred on that island. This is not just an average crisis. This is a disaster of significant proportions. And the resources locally, the resources territory-wide, island-wide, and even some of our national resources are really put to the test and stretched to the max. And we have to respond as a nation, and that is what we are doing. There is no question, as Mr. Perlman already observed, that New York has been disproportionate in this response. We have a real bond with Puerto Rico. We have what we sometimes jokingly refer to as the air bridge from JFK and Newark to San Juan, Puerto Rico, because of the free flow of people, material, and even people with health issues going back and forth. And that's why my region, the federal sector, was a combination of states here in the Northeast with the Caribbean territories, because health-wise that was a logical connection. We had an amazing team, but it's not just the individual people, but when the team becomes more than the sum of its parts. And some of you, I know certainly our brothers in uniform and sisters in uniform understand this, that we have coworkers, but we also have shipmates. And we were shipmates down there, everyone depending on the talent and the attention and devotion to safety that every other member of the team had. Because after you deal with the information crisis, the next step is force protection. And to that, we're really indebted to Fox over here, our best friend who stayed with us through the entire operation, and actually along the way was able to reach out to some of our co-workers, I'll now call them shipmates in Port Authority, our shipmates in some of the National Guard units that were down there that were interacting with us in San Juan and sharing information on what they saw, and others in San Juan Police Force and others that helped us find our way to accomplish our mission. And it was more than the team, it was the extended team, and that's what we so much appreciate. This spirit of cooperation is truly contagious. As Mr. Perlman said, just having a team down there giving what is obviously a finite amount of vaccine and bandages and some treatments for some lung crises, some heart crises, some diabetic crises that we ran into, the children that we examined. These were handfuls of people. These were maybe hundreds of people. But, you know, Puerto Rico has 3.4 million last time I checked. So we couldn't possibly cover the territory. But this is contagious. And when people see that people are coming to help, it spreads around. It's like the ripples on the pond. They go out in many directions. And I would like to believe that we gave some hope as well as some vaccine. I just now, in mentioning our shipmates, failed to mention FEMA. There's a large contingent of FEMA there, and we ran into them constantly, and they were always offering suggestions. Have you thought about this place? Have you thought about that place? And so forth. And finally, the Department of Health. I'll mention one really excellent thing that I had not seen before in all my years, and that was in Puerto Rico, the governor and the Department of Health very wisely issued an executive order that if you had a bottle of medicine for your diabetes or your high blood pressure and it was running low or it had run out, you could be out of luck. But because most of the physician offices were closed, many of the clinics were just starting to reopen this past week. But they passed this executive order that if you just bring your empty bottle or your empty box of insulin injections to a pharmacy, we're giving the pharmacy permission to refill without a new doctor's prescription. That seems like a small thing to do, but it made a total difference because at least if the pharmacy was nearby, if it was open, and if they still had the good stuff, they could get the good stuff and not have a diabetic crisis or have a stroke from a run-up of high blood pressure, which sadly I've seen before happen in disasters. There are a lot of secondary deaths that occur from disasters like this, and the goal here was to prevent them. I think Puerto Rico was extremely wise in putting that out. For the details of our operations, we have Dr. Michael Reilly. Dr. Reilly has also a long record in doing these kinds of responses. What he really prefers to do is prepare for responses because prepared communities are more resilient and they always do a better job of responding if they prepared and drilled. So Dr. Reilly will describe some of the details of what they do. Michael Reilly.
Good morning. When I received the call from Dr. Amler as I was stepping off a plane in Denver for a meeting, I got this text message, call me immediately, and spoke with him, and he explained to me on Monday afternoon that we were going to plan to attempt to do this medical mission on Friday, and that he basically, all he needed was for me to plan the entire medical contingent of the operation. There are a few things that are very important, regardless of any type of medical or humanitarian assistance when you're going to a active disaster area, and by all means, even a month later, Puerto Rico is absolutely still in the response phase of this event. We haven't even begun the recovery component. As you can see from some of these pictures, that's one of the reasons why is the extent and breadth of the devastation. So communities are still responding to critical needs. One of the most important things to do is identify or perform a needs assessment and determine what is needed. Yes, our primary mission was to administer or attempt to administer up to 1,000 vaccinations for tetanus, diphtheria, and pertussis. However, as astute clinicians and as experienced individuals, medical providers going into these areas, we realized there were two sort of things that you couldn't ignore that are part of that. First is with 1,000 individuals receiving the vaccine, statistically, some of them will have likely an adverse reaction to that vaccine. It might be a simple allergic reaction, it might be some other type of idiosyncratic reaction, but nevertheless, to be in a position to be in a rural area or a shelter or a place where there's really a lack of healthcare infrastructure and not have the ability to treat a vaccine reaction would be remiss on our part. So we need to make sure we have the appropriate medications, medical equipment, and supplies to make sure that the individuals we were vaccinating weren't already ill, didn't have a fever or a temperature, so they were unable to receive that vaccine, and then we were able to monitor them should something unforeseen happen after it was administered. The second important aspect of any type of healthcare delivery component that we needed to address immediately with the team, and we've seen this time and time again in nearly every disaster I've been a part of, all the way back to Hurricane Katrina and even locally in Hurricanes Irene and Sandy. The most common types of illnesses that we see are exacerbations or worsening of chronic illness. So you run out of your medication, you can't get it refilled, your primary care doctor's office is closed, or your specialist office is closed, or in these cases, the offices were destroyed. Right? We saw this in Coney Island, right? After many other places after Hurricane Sandy. Imagine that exponentially increased in Puerto Rico. So the access to these individuals, particularly in rural areas, to pharmacies or places to get their prescriptions filled is very, very limited. So as a result, we see people, and we did see people, with uncontrolled hypertension, high blood pressure. We saw people with diabetes whose blood sugars were dangerously high. We saw individuals with renal failure who normally require dialysis, who hadn't been dialyzed, hadn't had treatments in several days, experiencing problems as a result of that. People with chronic pulmonary conditions like emphysema, chronic bronchitis, COPD, or asthma, who had not been taking their maintenance medications and would come into our clinic to get a vaccine, but yet would have these other medical problems. Having had the experience in previous disasters of knowing we would see these patients, not only did we want to be prepared with the appropriate vaccinations, but we wanted to be prepared with the appropriate medical equipment, medications, and clinical supplies to treat those individuals that may have presented with those problems. And it's a good thing that we did, because we saw several individuals, a few of which had to be referred out to emergency departments, but we had individuals coming in with fresh second-degree burns from various attempts to light fire. We had individuals come in that having acute asthma attacks or acute exacerbations of their COPD, their chronic obstructive pulmonary disease. We actually treated a police officer on our security detail who had a chronic lung problem, who was having difficulty breathing. He received quite a bit of treatment. As a matter of fact, he received basically the equivalent of the treatment that he would receive in any United States emergency department, short of a chest x-ray. He received a 12-lead EKG. He received intravenous fluid therapy. He received inhalation medications through a nebulizer, several of them. He received steroid treatment through intravenous treatment, and we were able to allow him to be in the clinic and receive this treatment. And he actually, as in the U.S., we would have discharged him home with some instructions to follow up with his primary care doctor, which Dr. Amler did. But he actually returned to duty back to our security detail that afternoon, because it was so important to him to be a part of our contingent and to be there to protect us that he did not choose, even though he very well certainly would have gotten a doctor's note, Dr. Amler, to go home. but he was able to be well enough after our treatment to go back to work. So putting together the appropriate types of medications, bringing the appropriate types of medical equipment are very important as a companion piece to just bringing the vaccines. Just bringing the vaccines by itself would have been a bit problematic because we knew the types of patients that we would see. The other important thing was the complement of clinicians that we were able to bring with us. We were able to bring 5 clinicians with us. We were able to bring a physician. Dr. Amler was our medical director, was the lead physician on the team. We were able to bring 2 registered nurses. One was a pediatric nurse that works at Sloan Kettering. Another was a experienced trauma and emergency room nurse that works at Hackensack University Medical Center, and 2 paramedics, myself and Mr. Edward Lottery. This team of individuals was unique in a couple of regards. First of all, Dr. Amler and I both have decades of experience responding to disasters. I have over 20-year personal career as a paramedic and emergency manager, and having responded and deployed to many, many disasters. And Dr. Amler as a physician. But our clinicians were experienced, decades of clinical experience in dealing with very, very sick children and adults. And this was the perfect group of people to bring together in terms of types of expertise. So having an emergency room nurse that's very comfortable dealing with adults that can speak Spanish and is a native Puerto Rican, Jose, was a very important addition to our team. Ed, another seasoned paramedic who also is a native Spanish speaker, was very important for our team to have a cultural competency that allowed us to be as effective as we were. Cultural competency is something that we talk a lot about in healthcare. That we want to make sure that we are delivering care in a way that's sensitive to people's unique culture and experience and ethnicity and so on and so forth. But when we are guests in a part of our country, but that has its own unique culture and has its own unique language, we need to bring individuals who can relate and speak fluently and converse and empathize with these individuals in a way that some of us whose Spanish is a lot more rudimentary cannot do. So identifying clinicians as part of this team who not only were terrific healthcare providers, but who also spoke fluent Spanish and who were sensitive to exactly what they were going through due to their personal familial connections with the island was extremely important. We also had this as a result of our involvement with the Port Authority. All of the folks in the Port Authority that were on our security detail were fluent Spanish speakers. Many of them had a family in Puerto Rico, and having, again, that level of connection with the local population gave us access and gave us more credibility and allowed the public to accept us a little bit more than if we were completely outsiders or completely strangers coming in without that benefit. So those were some of the things that we did in putting together the medical team. We did this in essentially 72 hours. And we left on Friday morning, first thing, 8 a.m. So I want to thank all the individuals, just as Dr. Amler and Senator Murphy did, that were on our team. We wouldn't have been able to do it without you. So Ed, thank you very much. Appreciate that.
Thank you, Dr. Reilly. And as we get ready for questions, I want to again emphasize the aspect of force protection. When you send a group out into an area that's experienced a disaster, whether it's Puerto Rico, whether it's Texas, whether it's Lower Manhattan after 9/11, the importance of protecting the responders. And I know we have people, very important, very precious people in uniform here today. If there's one message I can give you and your colleagues, your comrades, it is always remember you are only as good to help as you yourself can help. And if you are impaired or neutralized in some way, you'll be no help to anybody. So your first job always has to be protect yourself as you're going into these things. Please always be careful because you're going into unknowns and uncharted waters. So, and that was true for our team. My greatest success ultimately is that all the team members came home safely and we can hopefully go back and fight another day. Thank you. So we'll open up now for questions. And Senator Murphy, thank you again for blessing us with your support for disaster response and preparedness that put us in a position where we can help you on this unintentional, unanticipated event.
Well,
Just came.
I gotta jump in there just because, this was not gonna happen. The Center of Disaster Medicine was funded through New York State, the Center of Excellence. There's 11 of them in New York State. This is the first one in the Hudson Valley. It just opened. Some other ones have been open for a number of years. This opened in July. This is incredible what this team did here to be able to put it all together. And again, I'm kind of a little remiss in saying this. It's not if, it's when we're going to need this team again. And being prepared, like Dr. Reilly and Dr. Amler says, is so crucial to be able to just get out and get it done. Like Mr. Perlman said, to be able to get in and do your job is so crucial. We had literally had a clinic set up in 15 minutes. Like Dr. Reilly said, the equipment that he brought down, 12 EKG, nebulizers, oxygen. I mean, it was a legit clinic that was set up with the help of a lot of people. And this is where, and I don't want to, we tried keeping all the politics out of this. That was the whole idea, is to make sure no one even knew we were down there. And that was very successful. And we were having this today to make sure we put light on the people of Puerto Rico and to let New Yorkers know, and they still need help, and lots of help. And New York has been doing an exceptional job with trying to make sure we get to the people of Puerto Rico, as you can see in the pictures. But that we do it the right way. So, Center of Excellence, Center of Disaster Medicine, great job.
Thank you. We're ready for our questions. We're good. Thank you all for coming, and we appreciate your involvement and your caring for the people of Puerto Rico. Thank you.